Good afternoon and welcome to Not Minding My Own Business. I am your host, estate planning and elder law attorney Russell Farbiarz, and I am joined here today by Adam Hawk and Lance O'Brien from MediConnect. Um, Welcome, gentlemen.
Hey, how you doing?
Thanks, Russell. Good to
Yeah,
see you.
good to see you. So I really appreciate you coming on the show, so we can talk a bit about Medicare, which is something that impacts, you know, pretty much the entire senior population, anyone over 65, anyone on disability. So it's certainly an excellent topic. Sort of before we jump into talking about Medicare, why don't you tell us a little bit about MediConnect and what you do and how you guys are different?
Sure. Well, good afternoon. My name is Adam Hawk. I work with MediConnect. We are a trusted community partner, a Medicare advisory, and we specialize in providing Medicare education and resources to individuals and their families and caregivers. Our mission at MediConnect is to make the complicated Medicare process feel simple. It's not simple, but we try to make it feel that way. And that's so that our clients can cruise into their Medicare years without having to worry about how to pay for doctors and medications and healthcare visits. We're a little bit different than other people in the Medicare space, which is one thing that I especially appreciate about our mission here at MediConnect. We carry all the major plans and providers in the area, so we give the opportunity of having the widest selection of plans and carriers to choose from. And I think the biggest thing that's really attractive to me is we have removed the profit incentive from the sale. All of our benefits executives are salaried, they're not commission based. I believe in my heart that healthcare decisions should be made without a profit incentive in place. My background is in not-for-profit healthcare operations, and that's where my heart is too. So I think that we're making a really great impact on the community, doing it a little bit differently. We're hearing it from our clients and patients every day.
And now, Lance, what is your role with MediConnect?
Yeah, sure. So I'm the CEO of MediConnect. So I'm running all the day-to-day operations across all of our different channels. And for me, echoing what Adam said, we really want to focus on education, right? Because this process is incredibly complicated. Let's start with someone turned 65, right? Then it's, should I sign up? Do I have to sign up? If I don't sign up, am I going to get a penalty? So there's not one hard and fast answer for that. And that's just the entry point, right? And then you've got part A and B and C and D. And then you've got advantage plans. Then you've got plan G and plan N. And you've got all of these different things being thrown into the soup mix, if you will. So for me, the big thing is we want to be able to provide education, and it's hard to provide education if your goal is to make a sale. And that's why I really think that Adam's point of all of our executives, they are on salary. So they're going to go into a home, sit across the table, do it over the phone, and basically they're going to listen to the person. They're going to see what's important to them. They're going to educate them, and then there's going to be time for that individual to make decisions.
Excellent. And I think that you really hit on the point that this can get real complicated in a hurry. I remember it was probably about 15 or so years ago, maybe even longer. My grandmother needed to apply for Medicare, and my uncle reached out to me and said, "Well, you're a lawyer. Why don't you, can you, you know, now all of his children are also lawyers, but he reached out to me, said, "You're a lawyer. Can you figure this out?" And I remember just sitting there and thinking, "Oh, what's the difference between this one and this one and this one?" And it's complicated. So maybe if you could just give us, a couple of minutes here. I'm not expecting you to get into too much depth, but just sort of give us an overview of what people need to know about these different letters that are going to get thrown at them.
Sure.
I'm gonna
So
I'm
I'll
gonna let
tack.
Lance take this real quick, but I want to share just a real quick personal story, Russell, because I had a very similar experience. My background is on the provider side of healthcare. I'm a physical therapist and an executive in healthcare operations for 20 years of my career. And when my parents got sick and their healthcare needs started changing, I had the bright idea that because I had so much experience and knowledge and depth and connection in healthcare, that I'd help them navigate that situation. So I got in the mail this summary of Medicare and You for 2025, which is a 131-page summary. So as I started looking through those 131 pages, realized that there's an extra 40 pages just on the different plans available in central Pennsylvania. I was overwhelmed, and I quickly realized that I don't have the capacity, knowledge, or ability to help my parents in this situation, despite having multiple degrees and a history of service in the healthcare field. It was very, very overwhelming.
Absolutely.
Yeah, so here's my funny story, and then I'll jump into the education piece. I know you're a lawyer, Russell, and you had mentioned, kind of similar to what Adam just talked about. We had someone that recently was listening to our radio show here in Western PA. He writes Medicare law. That is his job. And he came to us to assist him in the process of figuring out what to do. So that should tell you everything that you need to know about the challenges in this process. So let's start very simply with the red, white, and blue card, right? I like to refer to this as the foundation of someone's healthcare in retirement. And on that card, it's got Part A and B. On the card, it says Part A is hospital, Part B is medical. I want people to think of it this way. It's your inpatient and outpatient services. So it's the foundation of your inpatient and outpatient services in retirement. Now, Part A is free, meaning you don't have to pay a monthly premium for it, but it's not free if you use it. There can actually be a ton of costs associated with it, right? And Part B has a monthly premium, standard $185, right? But you can pay more or less depending on your income. But I think the big takeaway, at least in that, is Part A and B is referred to as original Medicare. Reason for that is because when Medicare started in 1965, all there was A and B, right? So we've got this foundation of your healthcare, but I don't want to live in a foundation, right? I want to live in a house.
Right. And I think it's all
to build on it.
But Lance, I also think it's important to point out, because I've had some clients who get confused by this. Medicare generally pays about 80%, correct?
On Part B.
On Part B. So it's an 80-20 split. So people need to be aware that it's not like, commercial insurance that you might pay a copay and then it pays everything else.
That's correct. There's pretty significant deductibles on Part A and per day charges. And then there's the 20% on Part B, but that's actually not really the worst part. The worst part is there's no maximum out of pocket for A and B. So like with the general health plans that they have, through their employer, they're going to have a deductible, a copay structure, and a max out of pocket, essentially a parachute, right? Medicare Part A and B, no maximum out of pocket. That's the real danger, right? So somebody has $100,000 in Part B charges, $20,000, and they're going to have to pay every bit of that.
And then now you can buy, and I don't mean to jump in here, but you can buy a supplemental policy to sort of cover some of that loss, correct?
And that's really the big question is, okay, so we have an understanding of the foundation, A and B, inpatient, outpatient. There's a little monthly premium there, but there's a lot of out-of-pocket risks. So how do I protect myself? And that's really the question we answer for a lot of people, right? So, there are two ways. There's actually multiple ways to get your private insurance, right? There in the central PA, if you're a state worker and the state offers you retirement, that could be your supplemental insurance. Our veterans can have options, right? People who have Medicaid have an option, but not to overcomplicate it. Russell, most people, once they get the red, white, and blue card, they're either choosing from a supplement, which some people call a Medigap plan, or a Medicare Advantage plan. And these two options are very, very different from each other. And one of the things I always tell people is one's not right, one's not wrong. They're just different. We want to help people understand how they're different so they can make a great decision for themselves.
So very generally, what's the difference between those two types of policies?
So there's an overarching rule for each one of them, right? So this, if you go with a supplement, that works with original Medicare. So in that scenario, Medicare A and B would still be primary, the supplement would be secondary. So that's the overarching rule. And the good things about that is because Medicare is primary, I can go to any doctor or hospital accepts Medicare. There's not a lot of out-of-pocket cost for my medical because Medicare is paying their portion, the supplement's paying their portion, right? But the positives of it are those things. Some people don't like it because it doesn't cover Part D, which we didn't even talk about yet. It doesn't cover dental, vision, and hearing. So there's more policies and out of pocket, where with an Advantage plan, that's basically a really weird mathematical equation. And the mathematical equation is Part A plus Part B plus Part D, which is prescriptions, equals Part C. Part C is Medicare Advantage plans. So in that scenario, they're no longer on Medicare. They're being taken care of by that private insurance company now who's providing them their coverage in retirement.
And is there an additional premium associated with Part C in addition to?
So great question. So when it comes to the Advantage plans, again, in most of the counties in Central PA, there's about 65 to 75 of these to choose from, right? About half of them in every county carry a zero premium. So there's not a lot of extra cost for these plans, although the premiums can get up to $100 or $200. But what we always tell people is, after reviewing both options, when we educate you, if you feel like an Advantage plan is better for you, you shouldn't spend more than $50 a month for that Advantage plan. The value is not in it past that price point.
Okay. All right.
It's really interesting because there are a lot of factors that go into this decision. It's everything from your prescription drugs and where they land on the formularies for each individual plan, to the network of doctors that you currently use or anticipate using, to even your own risk tolerance. An example, supplement plans, Medigap plans are often carry a higher monthly premium, but less out of pocket when you use the services. Advantage tend to carry a little bit lower monthly premium, but have some richer benefit services. And so there's balances. And I think the point that we want to get across is this really is an individual decision based on your situation, your risk tolerance, your family situation, everything around you. And making this decision in the back room, in a dark room without any resources or help, is really the worst way to approach it. I think that there is a feeling out there in the community that using our services means that people will pay more for their Medicare costs, or pay consultative services for our services. The reality is people will pay the same for their Medicare insurance regardless of whether they sign up for it on their own or that they use a broker or an agent. Our brokers, again, they don't have the profit incentive in place for a sale. We carry a wide book of business, and that's why we believe that providing that choice and the education for people to be able to confidently make the choice in their own situation is really important.
Okay. All right. So Lance, we talked about Part A and Part B, so inpatient, outpatient, and then we sort of jumped to Part C, but Part C also includes prescription coverage, right? And
Correct.
that's Part D. So why don't we talk a little bit about how Part D works?
Sure. So if you go with the supplement option and you pick up that plan, then you have to get a standalone drug plan. So in that scenario, the supplement's only going to cover Part A and B, inpatient and outpatient services. You'd need to get a standalone Part D plan. If you go with an Advantage plan, then the Part D coverage is going to be included in that. And one thing that I think it's really important to note, you are required to have prescription coverage through a Part D plan once you've been on Medicare for 63 days, even if you don't take prescriptions. If you don't have it in the first 63 days, then you will start being assessed a penalty by Medicare for that.
Okay.
There are a lot of potholes on the road to Medicare.
Oh,
We help to avoid those potholes. There were some Pennsylvania roads.
Yeah.
Yeah, they can be. Now, with Part D, I know it, and this I get a little confused because the federal government keeps changing things. But I know at one point there was a donut hole with Part D. I thought we closed that last year, but I'm not sure if that's been reopened. So can you talk a little bit about the donut hole?
Sure. So Part D coverage had 4 stages previously: deductible, copay phase, donut hole, catastrophic coverage. Okay. This year, they've done away with the donut hole, and that's a good thing for the consumer because basically, when they went into the donut hole, they would go from paying generally a flat copay for their prescriptions to 25% of the retail cost of the prescription. So, an example: someone that might have been on Xarelto, right, for AFib, that was a tier 3 drug on most plans. That would be about $40 to $50 a month, right? Once they would go into the donut hole, that carries a price of about $600. So their copay would go from $50 up to $150 when they
Mhm.
went into the donut hole. So what the Inflation Reduction Act did and the change that they made is they said, we're going to remove the donut hole, right? We're going to take that out, right? And then we're also going to put a cap in place of what somebody can pay maximum out of their own pocket on a calendar year, and that is at $2,000 right now. Now, there's a bunch of different scenarios around that. The good news is this is very positive for the consumer, but some plans actually will credit them for spending $2,000 out of pocket when they only maybe spent $1,000, the way that they're actually creating their drug plan. And that's where I think our services become so instrumental to someone, because we're going to sit down and we're going to actually compare those 70 plans on which one gives them the best coverage for their drugs. But yes, that donut hole has been eliminated, which is super positive.
Okay. And was that the Inflation Reduction Act that did that, or was that something
It was
else?
a part of the Inflation Reduction Act. The Inflation Reduction Act actually rolled out, without going into great detail, about 4 or 5 different changes over a period of time, limiting insulin to $35, including all vaccines, eliminating the donut hole, allowing them to actually be able to negotiate Part D drug prices with the pharmaceutical company. So there were some really good things in that bill that was passed.
Okay.
There's
And so
been
the
some interesting ripples due to this donut hole closure. What we know in our industry is that only a third to a quarter of people read their annual notice of change, which is the updates to their Medicare insurance plan each year. Because of the elimination of the donut hole, that has pushed insurers to adjust premiums and to adjust benefit offerings and to adjust the list of medications and costs, which they call their formulary. So we are seeing now, after the 2025 plans have started to take effect, we're having people calling us saying, oh my gosh, my out-of-pocket spending has changed. I thought I was on the same plan. And the issue is they didn't realize that their plan had changed. So in response, insurers have adjusted premiums and benefit offerings. So we've seen changes in the Medicare Advantage realm to dental benefits or to vision benefits. Many plans had out-of-pocket spending benefits like grocery or transportation benefits and things that people relied on for a lot of their care. So we're helping people navigate that through our open enrollment period, which is January through March here, where Medicare Advantage beneficiaries have the opportunity to change their coverage if they're unhappy. But it's been an interesting ripple. The donut hole closing unquestionably is positive for the consumer, but does have some unintended ripple effect.
Yeah, and I just want to add on to that because that's an awesome point that Adam made. So basically, all the laws that they passed around this, very, very positive. However, someone has to pay for those costs, and a
right.
lot of that was passed directly to the insurance carrier, and then the insurance carrier is transferring now some of that cost to the individual consumer. So positive altogether, but it's been a little bumpy this year, and I believe it will be next year as well, as they're figuring out how to share this cost in the most equitable way.
And that's always what happens when you have these sort of changes, particularly I think in health insurance, because the insurance company's not just going to take it on the chin. They're going to want to share some of the pain, unfortunately, that comes with it.
And the
Absolutely.
way that we help our clients with this, we do intentional outreach throughout the year to our clients. We do intentional plan reviews with our clients so that we can highlight any changes that may happen with their current plan or identify any opportunities for change to save out-of-pocket spending. So the way that we try to help our clients is really being proactive with that intervention and having the opportunity to review that plan coverage to ensure that they have the right coverage for their needs.
Right. And now we talked, it seems like Part C includes some dental and vision benefits. If you're not on Part C, what do you do for dental and vision?
Yeah, great question. And that's one of the big things with the supplement. I think the best way to kind of define that is it's a la carte, right? Quick story. When I went on my honeymoon almost 30 years ago, we were in Cancun and we were staying at an all-inclusive resort. We walked down the road after a few days. We're like, hey, we want to try something else. We went into a Ruth Chris Steakhouse, right? If you've ever been there, there's a price for the steak, a price for the potato, and a price for your veggie, right? And that's really how Medigap plans work, the supplement plans. You got to pay for your health plan, then you've got to pay for your dental plan or your drug plan, sorry, your Part D plan. And then if you want dental, vision, and hearing, you either have to pick up another policy for that or you have to self-pay. So that's one of the inhibitors to people when they're choosing it. Again, one's not right, one's not wrong. Adam's probably heard me say that 1,000 times already in the time that we've been working together. It's just how do you want your health care to work, right? So, like, if they go supplement, they're going to have to self pay or get another policy. If they go advantage, it's going to be in that policy, more like a happy meal, if you will.
Right. And I think that's important to note because I'm not sure that everyone sort of realizes that's the case, that it's not all inclusive. Now, are there any other, letters in the alphabet that we need to worry about when we're talking about Medicare?
Well, again, we've been referencing these supplements over and over again, or these
Yeah.
Medigap plans. They are actually um, their naming nomenclature, their
Mhm.
naming mechanism is essentially letters as well. So someone's going to choose between a plan N or a plan G or a plan. I would have loved to have been in that room, Russell, when they were saying, hey, how do we name these? Right? Oh, well, we'll just add some more letters in there. And so those are the other letters you need to know about. So if someone goes with a supplement, their supplemental coverage is going to be a letter, not so
Mhm.
much when they go with an advantage plan.
Okay. I just remember when I did this for my grandmother, there being all these letters and it was like alphabet soup and
It
trying to
is.
trying to figure out which one is the best one. So I,
The
I
interesting thing about supplements too is they are administered by private insurance companies. So you will see different insurers that carry the same Medigap policy,
right.
but at different rates. So the offerings of the Medigap policies are standardized. They are determined by the Centers for Medicare and Medicaid Services, but there are different prices. And our opportunity as MediConnect is to ensure that our patients are paying the right price for the right plan. Medicare Advantage is different. There is many different benefit offerings, combination of benefits, and how to use those benefits in different Medicare Advantage plans. As Lance mentioned, there's 60 or 70 just right here in central Pennsylvania, and they differ by county, by the way. So
Mhm.
it's a very kind of complicated. The alphabet soup can be overwhelming. The amount of plans can be overwhelming. The understanding of Advantage and Supplement can be a little bit complicated, and our goal is to make that feel simple.
Yeah. So I'm going to ask you, to take out your crystal balls now and sort of give us a forecast of what you think the issues are going to be, as we move through 2025 and get to 2026, and because there's been a lot of ripples, particularly with the new administration. So what do you think people need to be aware of, need to look out for as we move forward?
Yeah, so I'll start just talking historically really quickly. Up until 2006, you could only choose from a supplement or original Medicare. In 2006 is when Part C and D became active and these Advantage plans were rolled out. And honestly, Russell, for the first 10 years, enrollment in them was very kind of slow, right?
Right.
Once we got to about 2016, 17, the private insurers figured out how to make them attractive to the individual consumer, right? As well as cost effective for themselves, where now 54% of Medicare beneficiaries are in Medicare Advantage plans. So I think that answering your initial question off of that context, right? I think that we're going to see more people going to Medicare Advantage. Again, not saying that's the right solution for everyone. I want to be absolutely dogmatic about that, right? Because we run into people who say, if you don't do this type, you're doing it wrong. And I believe it's the individual consumer's decision. But I think more people are going to go Medicare Advantage as we go forward. And here's the big reason, right? Many of these people are living on fixed incomes, right? And with the inflation and other rising costs, they're trying to figure out what's the best way for me to be able to get good quality coverage without breaking the bank ultimately, right? And they're finding that in the offering of the Medicare Advantage plan. Because honestly, for most people that go with a supplement, the financial resources are there for them to be able to make that without any other mitigating factors. So I think we're going to see more migration. I think we're going to see a stabilization after the next year in some of the benefits, where this year there was really kind of a tumultuous sea, if you can, right? And I still think that there's a significant place for the supplement for those that want travel and predicated costs ultimately.
Yeah,
Okay.
I think that we'll see a lot of changes in the upcoming years. I think it's going to be a few tumultuous years. And the thing that I want the consumer to hear is that it's very important to have a trusted advisor to work with. We do believe that we're the best. When I was helping my parents with Medicare insurance, I asked the organization that I was working for how to find resources, and they said we don't have resources a health system. That's not our role. Call the insurance company. I thought to myself, if I call the insurance company, they are likely to sell me their insurance, and I don't know what the other choices may be. So I looked around and I found some independent brokers in the area. Some carried some plans and other carried the other, and I got overwhelmed because I couldn't find a single place that didn't have a profit motive in place, that carried all the spots where I could have a clear picture of what my choices are among all of the options that are available out there. I knew that there was a lot of options. I didn't know how many options, but I knew there was a lot of options, and it can become quickly overwhelming. So if the listeners hear one thing, it's ensure that you have a trusted partner to help navigate these Medicare resources. We're a great option if you don't have that trusted partner. We're in central Pennsylvania. We have boots on the ground. We have a full client experience department to help support our clients. So having these resources in place is a very important piece.
So when someone works with you, Adam, what can they expect? Like what's the
Yeah.
how does it work?
Great question. A lot of people start out by attending one of our free seminars. We have seminars throughout central Pennsylvania on a monthly basis. In February here, we have 3 seminars, one in Ephrata at Wellspan Brossman Health Center. We have one at Oak Street in Harrisburg. We have another at another Wellspan location. So we have community education throughout the year. Many of our clients start to engage there. Many people who attend our seminars end up scheduling a free no obligation consultation with us, which is a personal visit from one of our executives, so that they have the expertise at their fingertips to cruise into their Medicare years without having to worry about how to pay for their doctor bills. We routinely save people thousands of dollars each year and find additional benefits for them that fit very well in their needs, whether that's transportation, grocery benefit, dental, or vision. We help out with that. The people who benefit most from our connection are people who are facing the Medicare decision for their first time. So usually people 64 years old who are thinking about that Medicare decision, or had a recent diagnosis that puts them in Social Security, disability, and education eligible for Medicare, or diagnosis of end-stage renal disease or ALS. So in those situations where people are approaching that Medicare decision is a really important opportunity to connect with a trusted resource. And with these changes each year in the Medicare plans, people who are currently on Medicare around those enrollment periods, and we, as insurance brokers, we have the opportunity to create special enrollment periods at different times of the year if a situation warrants. But as healthcare needs change, as medications change, as doctors change, as locations change, that's where we're most able to help people.
Wonderful. And if someone who's listening is looking to connect with you to see what their options are, what's the best way to do that?
Yeah, best way to do it is two ways. One would be call our main line, which would be 888-818-6334. Again, 888-818-6334, or they could go to our website, MediConnectInsurance.com. They can start a live conversation there. They could schedule an appointment right from the website. And again, that process is going to start. It's about a 60-minute meeting when we meet with someone. So about an hour, we can go to their home. They can come to us. We can do it over the phone, and we'll walk through an intake form and then answer any questions around their prescriptions. We'll check their doctors. So it'll be a very comprehensive experience for them, where we'll take those 70 plans we've kind of referenced multiple times, and we'll bring it down to 2 or 3 options that are best based on all the information they gave us to make a decision off of that.
Okay.
And if any of our listeners visit our website, I would encourage them to look at our Google reviews. We have over 1,000 5-star Google reviews, and our customers' comments say it best. Many of our executives are mentioned by name in those comments and reviews, and we strive very hard to build relationships with our community and our clients.
Well, thank you so much, Adam and Lance, for taking the time. I know I learned stuff about Medicare, so I'm sure that that our listeners did as well. So thank you again for joining us here today.
Thank you, Russell. Really appreciate it. We'll see you soon, I'm sure.
Yes, we'll definitely see you soon.